Knowledge is power, and I'm going to give you some more knowledge today. Today we're talking about surgical terms, and the terminology that's used by a lot of physicians is actually very incorrect. And so if they don't know what you were to use to describe what they're doing, how do we have any confidence they're actually doing the right thing? But I don't want you to fall in the same pitfalls because of a lot of misinformation and operative reports out there. So to start with, we're going to talk about the difference between coagulation and burning surgery and excision surgery and vaporization. And today I'm going to talk about coagulation. So first of all, there's a concept known as power density. What that means, you can have a certain amount of power, but over how big of an area is that spread. If it's a very small area with that power, then you're going to have a lot of energy into the cell. If it's spread over a large area, then you're going to have a decreasing power density because that power is spread over the entire area. And it turns out there's only two things that happen at the tissue level with heat. Now, in the old days, we used to make big incisions and use our hands to use scissors and stuff. That's mechanical energy. We're using thermal energy or heat. And so how that heat is applied determines what happens to the tissue. And so if it's below a certain power density, so we're in the 65 to 100 degree centigrade range, then you coagulate, cauterize, or fulgurate. And they're very similar, but technically a little different. So let me just go through that. So coagulation is disruption of tissue by heat, causing denaturation and clumping of the protein. This occurs between 65 and 100 degrees. Cauterization is passing electrical current through tissue to cause coagulation. This type of electrical burn, it's derived from the Greek word meaning cauteron, meaning branding iron. So branding irons going on inside women's bodies, not the best. And then fulguration comes from the Latin word meaning sheet lightning, and it's a drying tissue of a high frequency electrical current. And actually, with fulguration, you're not actually touching the instrument, so there's a little arc of electricity that goes across. And so you'll see these words used interchangeably, but there's unipolar cautery, there's bipolar cautery, and the unipolar is where you have a little electrode, a little metal pin that comes out, and the electricity passes through there, heats the tissue, and by the electrons going through the water, and then this heating is fairly slow. So it's kind of like simmering a pan of noodles. You know, the water slowly evaporates and simmers off. And then the noodles that are left, they get all gooey and sticky and maybe black on the edge. And that's where the proteins are getting denatured and clumping. So it's very imprecise. So when you're cauterizing or coagulating something, then there's heat that's spread. The very center part is the hottest, so you get black crispy critter, that's obviously dead. And then on the side you have what's called a zone of necrosis, where the tissue looks okay, but it's been heated enough that it's going to die off over the next couple of days. So if you happen to be around the bowel or some other vital structure, you're going to have a complication, you know, where the tissue dies off later. So that's why with endometriosis, where there's so many things, you know, blood vessels and nerves and bowel and bladder and ureters and all these things that you need to not damage that are right under the layer of the peritoneum. When you're burning that peritoneum coagulation, then you're really risking getting a lot of other damage inside. And so that's why it's not good. So again, coagulation, cauterization, fulguration equals burning surgery equals bad. Okay, we don't want to do it because it's imprecise and it causes inflammation and tissue damage. And what we know on how the macrophages are creating pain in those endometriosis lesions, we're just stimulating that process more as opposed to taking the whole thing out with excision. So that's it for today. Next time I'm going to talk about excision, and let me know what you think. And also I challenge you to pass this on to somebody else, because the more we educate women with endometriosis, the sooner we're going to see the changes that we want in how they're treated and how endometriosis is treated. All right.